I am delighted to welcome you to this afternoon's Research Connects webinar. My name is Dr. Heather Cook, and I'm the Manager of Research and Knowledge Mobilization here at the Alzheimer's Society of BC. And I'm joined today by my colleague, Dr. Sarah Wu, who is our Strategic Lead Research. And as part of our roles at the Society, we help make research more accessible by connecting researchers, such as our guest speaker today, and experts in the field with folks who are using that work or interested in that work. And that's all of you who are on the call today. On that note, I'd like to introduce our guest speaker today, Dr. Sheila Novak. And Sheila conducts research on aging and is currently a CIHR-funded postdoctoral fellow, that's a mouthful, in the School of Nursing at UBC. And using critical qualitative methods, Sheila's research explores the experiences of older adults, people living with dementia, family carers, and care providers across both community and long-term care contexts. And we're delighted to have her joining us today to speak about her work on family and resident councils. So welcome, Sheila. I'll stop sharing my screen and turn it over to you.
So thank you so much. I'm really honored to be here to share this work on resident family councils, and particularly with this audience and through the Alzheimer's Society of BC. Just go ahead, since I already had such a lovely introduction. So I wanted to mention that this research was done at University of British Columbia Point Grey campus, which is situated on the ancestral unceded territory of the Musqueam First Nation. I'm connecting to you actually from Winnipeg today, which is where I live right now, and it's also where we're doing the second phase of data collection. So we're continuing the research here. And Winnipeg is located on the original lands of the Anishinaabe. Sorry, I just having trouble with my, there we go. Innuit, Assinininewik, Dakota Ayote, and Dene Sulene, and the homeland of the Red River Métis. And so we have representing sort of two different places today that where this research took place. I also want to acknowledge the broader team. This is very much a team effort. First and foremost, the long-term care homes who participated in this project, and specifically the care home in Vancouver that I'll be sharing findings I'll be discussing today, and the council, so the resident family councils there who took us in, let us watch what they do and take notes, and collaborated with us on this project. And then our research team, which is situated at UBC and also University of Manitoba. Just to mention, we're also very fortunate to have Dr. Heather Cook as a collaborator from the Alzheimer's Society of BC and helping us with knowledge mobilization. And I also just wanted to acknowledge our funders as well. We have an Insight Development Grant from Social Sciences and Humanities Research Council of Canada, without which this work wouldn't really be possible. So maybe on that note, I thought I would just give you a little bit of context in terms of how I came to this project and where the seeds of it developed for me. So I finished my PhD back in 2021. And so that was during the pandemic. And like probably most of you, I had been watching the news and seeing really devastating reports about what was happening in long-term care. And I've been doing research in long-term care and sort of related to long-term care for 15 years. But it was the first time in my experience where there was a real national conversation about reforming long-term care, systemic issues in long-term care. And it seemed like some momentum and a social movement to try to address some of these long-standing problems. And so when I was thinking about what I wanted to do next, and I knew I wanted to apply for a research position at UBC, but I needed a new idea. And I thought, I was thinking about how can we sustain this momentum and kind of help support a movement grow? Because it seemed like the first real window of opportunity for change and progress in long-term care in a long time. Um, and it occurred to me, well, wait a minute, there are resident and family councils in long-term care homes across this country. And there are people working hard and putting their energy into making change and improvements in long-term care. But I really didn't know much about it. They weren't visible, and particularly resident councils. I did see some, family councils and family members representing family councils speaking out a little bit in the news, but by and large, I really, couldn't figure out, they weren't visible and their work wasn't visible. So I did a little research and I realized there was a huge gap in terms of knowledge. So that resident councils and family councils have been around and been working in a common practice in long-term care for decades, and they've been part of the laws. So they have had the right to participate and to form councils in long-term care homes, in different provinces over the last 2 decades. And yet we know very little about what they do, how they work. So I decided to look a little deeper into that, and we formed a team and we got this grant. So here we are. So today I'm going to share a little bit about what we found, particularly doing this research in BC. So the first question I asked myself and then went to the literature was, what exactly are resident and family councils? Like, I sort of had an idea, but what do they do? And when I look at the academic literature and you look over time and in different places, there's no single definition. There's different roles that these councils can play and different ways that they're defined sort of across time and space. In the simplest terms, a council is a group. It can be residents, it can be family members, or other people who are of importance to residents who get together on a regular basis. And what do they do? Well, it really depends on the group, and it depends on the context in which they're working. So what's supported and what are they enabled to do? And what are their interests? What do they want to achieve? So it can be as simple as, residents, for example, getting together and talking about whatever's on their mind or what matters to them. Councils can fundraise and plan activities. Education and peer support comes up a lot in definitions, and the ones I've bolded here are some of the, I think, key components when we look at in BC in terms of, the legal definitions and the definitions and guidelines and policies. So education and peer support. One thing that's really important is that they provide a forum or an avenue to provide input to management. So this idea that they'll get together and they'll come up with suggestions, solutions, concerns, ideas about what's working well, that they're going to be providing input, guidance, complaints to management. How exactly they do that and how management responds, that's a little less clear, but the idea that this is a forum for sharing ideas and concerns with management, I think, is really important. And in some cases, including when we look at the laws and policies in BC, is the idea that they're promoting the collective interest. So they're working on behalf of kind of the whole and trying to represent the interests of the resident population and family population. There's one more possibility I wanted to add to this, and I think, I'll talk about it a little bit more. All of these kind of the first bullet points I have are really about making change or doing things, having an influence within a particular care home. But there's also the possibility that by forming a group, that group could help serve as a platform for making broader changes or connecting with outside organizations or participating in advocacy in other ways. And I think that's important because a lot of the issues in long-term care are systemic. And it's important to think about not only how can councils influence the home in which they're operating, but if they want to, if they choose to, if it's of interest, how might they also have a kind of broader influence or be able to connect and advocate outside of the home as well. So that's another possibility, but not one that's often written into definitions. So as I mentioned, they've been part of the laws governing long-term care, and in Canada, that's provincial. So there's different laws and different regulations and policies in every province. But residents in particular have had the right to participate in resident councils for some time. Family councils, that came a little bit later, and it's not as ubiquitous. So some provinces, families have that right. They do in BC, but not in others. But those laws have been around for some time. And then with COVID-19, first of all, there were the devastating impacts in terms of resident mortality and staff as well, their health and well-being. But there was also the impacts of the public health restrictions. So we saw that residents and their family members experienced restrictions on their freedoms that most of us as Canadians never had to grapple with. So, family visitors were not allowed in for a prolonged amount of time. And also within the home, if there was an outbreak, residents might be isolated within their rooms and not be able to socialize, and they weren't able to get together with other residents. And so this had real profound impacts on people. Of course it did. And coming out of this, I think it generated a real critique looking at, why were residents and families not involved in that decision-making process? Why were these restrictions and public health policies imposed on residents and families without consideration for what it meant to them and whether they would want to live with some risk and kind of balancing, the public health measures with residents' rights as well. So there was a lack of balance and inclusion in the policy process. So kind of coming out of this phase of the pandemic, we saw, provinces across Canada started updating their regulations, in large part because of the scale in terms of deaths that we saw in long-term care. But as part of that, they have been revising and kind of creating more robust regulations around resident and family councils. So there's been this kind of renewed interest in resident and family councils, and the idea that by having resident family councils and kind of promoting and protecting them, they can serve as one mechanism to ensure in the future residents and families will have some say, that policies will not, just be kind of single-handedly applied, that they will have some sort of say to kind of counterbalance some of the impacts we saw during the pandemic. So, and in a large part because of the activism of families and residents as well, really pushing to have more of a say in long-term care policies and within long-term care homes. So that's certainly the case in BC. The residential care regulations were updated in 2022. And as part of that, there are much more robust provisions for resident and family councils. They're much more detailed, the kinds of supports that care homes have to provide to resident family councils. There's protections. It sets a number of standards that care homes have to meet, and they have to report up to the Ministry of Health. As I mentioned, there's also grassroots organizing happening. This didn't happen in a vacuum, right? This is something that people were pushing for and working hard to push for. So there's now in BC the Independent Long-Term Care Councils Association of BC, with its acronym, which I'll try to get right throughout this if I mention it again. It's a little bit long, but I believe they were formerly the Family Councils Association of BC. So it's a network, a provincial network of family councils, and they have regional associations for each regional health authority. So they've formed and they can provide, information, support, networking to family councils. I'm not sure if they do it as well to resident councils. So if there's anyone involved in this organization, you can correct me in the chat and let people know. There's also been, as part of the new the new regulations, the Ministry of Health put out a new guidebook, and they've also established, these are government-led regional and provincial forums as well for resident and family councils. So there's more infrastructure, both, from the government, but also sort of from the bottom up to support resident family councils, and there's more interest. So that'll take me to this study. So the sort of overall goal was to better understand resident family councils. How do they work in practice? So to get a kind of more in-depth view. And we wanted to know, what are sort of the everyday practices? How does it work? The structure of the councils, what does it look like? But also to understand at the organizational level. So what is it the organization can do to help support family councils? And then sort of the broader policy level, community level, what else needs to be in play? And so we wanted to know what can help and support their efforts, and what constrains or makes their work a little bit harder. And ultimately, the hope is to identify some promising practices. And here, I borrowed a term from Pat Armstrong, promising practices, and she talks about, in long-term care, there is no one size fits all. So instead of talking about best practices, because every council is going to be different and they're going to have different needs and interests, we can just talk about some promising or innovative findings for other councils or other organizations to consider. So the way we design this study, it's an ethnographic project. Today I'm going to be presenting our findings from Vancouver, but we're also repeating this now in Winnipeg. So we have a kind of provincial comparison. So we did, so by ethnography, it really means we did in-depth research in one place, so kind of a case study. And we worked at a nonprofit long-term care home in Vancouver, which was a fairly large facility, close to approximately 200 beds. And the research involved in-depth interviews with people who are engaged with their resident and family council. So they had both were very active councils. So we talked to staff, we talked to residents, we talked to family members. We also talked to some key informants, so people outside of the home who had expertise about, the policy context of resident family councils. And then we did observation. So we sat in on 6 resident council meetings, 6 family council meetings. I went with my research assistant and we took notes. We took notes about what we saw, what we heard, what people were doing. And then we took all of that data, so the transcripts from the interviews and our field notes from sitting in on council meetings, and we reviewed it and analyzed it. And so that's what I'm going to be presenting to you today. So first, I thought I'd just share a little bit about the kinds of issues that these 2 councils addressed. And we found some differences between the resident and the family council. So the resident council, and this is really just a snapshot in time, right? We were there for just 6 meetings, and this is an active council. So if we came at a different time of year, it might look a little bit different. But there's a tendency to focus on really kind of daily life, things that were affecting residents in the day-to-day, and also making kind of more concrete changes. So perhaps not surprisingly, the topic that came up the most while we were there was food. So all sorts of food-related concerns. Another common issue was around accessibility. So that could be, building accessibility The resident council had worked on making the elevators more accessible, having the outdoor patio repaved. That was something they'd lobbied for, so it would be more accessible. And an upstairs patio to make that more accessible for residents so they could have more access to outdoor spaces. Recreation came up as well in terms of, suggestions for recreation activities. And then I have on there council procedures, and a large part of that was because they were having an election at that time, which we got to observe. And so there was discussion, around election procedures. But food was really something that mattered so much to residents, and a real topic of conversation. In terms of the family council, what we saw was a little bit different. They tended to focus more on policies and quality improvement processes. So there was a fair amount of discussion on policies like the admissions process. What happens if, what's the process or policy if someone is transferred from one unit to the other? End of life process and protocol. Human resources, things like staffing retention, having agency staff, and care practices. So, written, how are we communicating with, or how does the facility communicate with families if something comes up, things like that. And so they were looking at a range of issues, but often through the lens of what's the process, what's the protocol, what's the policy. So that was a little bit different, but similarly covered a range of issues. Food came up as well, but not quite as commonly compared to resident council. So it's interesting because there's important overlap, but there was also differences. They had a different kind of scope, a different focus, and a different approach. So I think that's important because they can really complement each other in that way. So in terms of the resident council, just to give you a little kind of flavor of some of the issues they discussed, my research assistant Isabel Wong's been doing some analysis looking at the food concerns resident brought up and what concerns resulted in a sort of agreed upon plan for change and which ones didn't. So we found they had a lot of input into menu planning. And part of this was because they were able to meet regularly with the food services manager. So they got to make changes to the menu. They went over, upcoming menus and got to have, new dishes added and dishes they didn't like, altered. Sometimes they weren't able to make changes to the menu in part because there was disagreement. And, one of the issues with food is that on the one hand, like I said, this was such a common issue. This was something residents cared about so deeply. It really impacted their quality of life on a day-to-day basis, but it's also such a personal issue. People have really different preferences. They have different diets, different experiences. So there sometimes, was an agreement. They also were less likely to, their suggestions were less likely to result in an agreed upon change when they were a little bit more at that kind of process level that family council was able to operate at. So for example, concerns about the temperature of the food, resident being concerned that the food is arriving cold. Or the timing of meals. What about the overall food quality? Wanting to reduce waste. And it was interesting, a number of residents were really concerned about food waste and portion size, and they weren't really able to make any headway on those concerns. So in some areas they had a lot of input, and residents felt really empowered to be able to contribute and make real changes to the menu and be consulted with about the menu as well. And then some residents felt frustrated that they weren't able to address some of those bigger issues about like food quality, what about the quality of the food or the process and the temperature of the food. I wanted to share this. This is actually from the care home in Winnipeg, where we're doing data collection right now. But I thought it was so neat that I just wanted to, even though it's not from the Vancouver side, I wanted to share it. And at this home, during the pandemic, they changed the bacon. And I don't know, I was told there were supply chain issues. The residents felt it was a cost-cutting measure. Whatever the case, the bacon was changed and the residents didn't like it, or some residents at council brought up that they were not happy with this new bacon. And they had a new food services manager who was new to long-term care. So his background was in the restaurant industry. And, he said, okay, well, what in his, career and in working in the restaurant industry, when it came to food, they did food tastings. If they were looking for a new supplier, if they were adding a new menu item, they would have a food tasting. So that's what he set out to do. And he invited the residents who had expressed concerns about the bacon and others from council who were interested. And he asked his suppliers for, I think he got 5 different kinds of bacon. They had some support from staff, but they got to taste each one and rank it. And they got to sort of together as a group, come to a consensus and choose a new supplier, a new bacon product. And then this resident added that, her biggest concern wasn't the sort of distinction between the different types of bacon. She felt it wasn't crispy enough. And so she got to voice this directly to the food services manager. Well, it really, most importantly, needs to be more crispy. And so everyone, staff, managers, and residents were all really pleased with the outcome of this process. And the residents have bacon once a week. So every week they get to kind of experience the fruits of their labor there, the outcome of their effort. So I just thought it was interesting because sometimes we would see, some residents had a lot of ideas and suggestions for menu planning. But sometimes if they're asked, if a manager comes and says, we're planning our menu for spring, do you have any thoughts, anything you want to see, anything you want changed? That's a big question. That requires a lot of kind of, remembering and thinking. But something like this where it's in the moment, it's interactive, you can taste it, you can try it and be supported in making that decision was really valuable, or at least in this case, everyone was pretty happy with the outcome. I wanted to mention the Family Council, and this Family Council had been active since pre-pandemic, so they were quite experienced and had established pretty strong relationships with management. So that's probably an important part of the context here. But they, as I mentioned, focused and had quite a number of effected change in terms of a number of policies, and were involved in quality improvement processes. So the admissions process, they were engaged in and had advocated to have make some significant changes, and they were able to kind of revamp the admissions process and make sure that families were getting the kinds of information that they needed. So families were being bombarded with information, but not necessarily getting the information that was most valuable to them. They had found a number of families had talked about problems with admission, and so they tackled this problem. They did the same thing in terms of end of life. So developing a pamphlet and making sure families were getting the information they needed, and support with decision making earlier on. And during the meetings, we observed other issues came up, like what about when people are transferred, and the question was around, should we look into this process as well? So they were really operating at that higher level, not exclusively, but they were able to affect real change in terms of policies and protocols, and being part of the quality improvement process, working kind of in collaboration with management and leadership. So next, I thought I'd talk just a little bit about some of the council processes we observed. So how does this work in practice? One of the challenges for councils, and one of the kind of core activities that we observe that they have to do, is figure out, what's an individual concern and what's a collective concern. Because as a council, they're trying to come up with, ideas and suggestions and advocate for issues that will kind of benefit the collective, whether that's residents or families, the home as a whole. And sometimes that's really obvious, if a problem is more kind of individual, was it, a medication issue that happened, but sometimes it's not, and sometimes it's more gray, and the way people present the problem, you might need to interpret it a little bit to figure out, okay, is this something that's collective, or is this particular to this person, something that they need to address, more on an individual basis. So this happened first at an individual level. So before people even shared an issue, they were often grappling with this themselves. What's appropriate to share at a council? Is this of interest? And part of that comes from the kind of feeling of, when you're sharing within a group, you're in a group setting. What are other people going to think? Do they have this problem too? Am I going to sound like a complainer? So there's sometimes people describe having some hesitation around sharing their concerns, which I think is represented in this quote, am I the only one? And that's just part of being in a group. But part of it was trying to figure out, what is collective? I have a number of experiences, a number of concerns, but which ones are appropriate for family council, and which ones might I pursue on my own by, trying to talk to a staff member or a manager. So that happened first sort of within individuals. And then once they shared it, they're sharing it within a group, and it was kind of up to the group to respond and to try and interpret and figure that out. And that can be challenging because people, we tend to think about, especially when we talk about residents, there's a tendency to think about them as all the same, as a homogenous group. But they're not. They're very diverse, and they have, different experiences, different needs, different preferences. And even, we found people in different units might have very different experiences and different issues. So there's a lot of diversity, and so finding common ground can be challenging. So that's where I think too, having a really skilled facilitator is important to try and help tease out, if a concern is more of a collective concern. We noticed that in family council, a lot of participants were very good at framing their concerns, very skilled as collective concerns. So, for example, I mentioned the transfer policy. So, someone brought up this issue, and they could have said, I had this experience, my parent was transferred or my relative was transferred, and I'm really upset with how the staff spoke to us, and I'm really upset with the information we got and just how it happened. And then other people might have said, oh, I haven't had that concern, or oh, that's too bad. But they framed it as, this question around what's the policy? We worked on admissions process. What about transfers? Is there a similar process in place? Is there a policy in place? What's it supposed to look like? So even if other people didn't have the same experience, they understood this as a kind of more of a collective issue. With residents, I think presenting an issue as a collective problem for some can be a bit more challenging. But they did have ways that they were able to do this. And I think in part by focusing on issues that they knew were shared concerns. So that was food. And also with this council, accessibility, the building accessibility, it's hard to argue that that's not a collective concern. But there's a tendency to focus on issues that were kind of known within the group as important or shared concerns. So that was another way that they could, even if they weren't framing things as a policy or a protocol, they were speaking to kind of a shared concern. And then again, this process happens when they bring these issues to management. And sometimes management, if they were a little reluctant, or maybe they wasn't an issue that they, or a suggestion they agreed with or were able to, or felt able to address. They might question how representative, how collective is it really? Well, it was just a small group. They're not representing everyone. So sometimes that issue of representation can come up here too. This was an issue around inclusion and participation that came up a bit more with the resident council. Well, I say a bit more. It came up with the resident council. It did not come up in this case with the family council. All of that sort of process and deliberation I'm talking about, that requires a really kind of skilled facilitator to make sure that people feel heard and included, even if the group chooses not to act on an issue or not to address it. And for residents, that was one area where we saw residents potentially feeling hurt, feeling excluded, feeling diminished, when they brought up issues that were not necessarily, validated, or if they didn't feel heard or welcomed by the group. So here are some quotes. One resident's talking about another resident that she really valued her approach. She really valued the way she spoke to the group, and that was something she thought was really important. And another saying they felt like they were being dictated to, it had a number of, there were times we saw residents in tears, to be honest, feeling excluded, feeling not heard. And at the bottom, I think this resident brought up such an important point. The people need to be taught. This is an important skill. People need to be taught how to participate and also how to facilitate this process. And I think, I would really strongly recommend that developing some resources and supports specifically for residents around inclusion and kind of facilitating the group, right? Having some training and resources for them, because this is a challenging, skill set. And in a lot of ways for residents, it's more challenging because they're coming with multiple vulnerabilities, right? There's already, being in a home, well, some described it as really intimidating. It's intimidating to come to a council meeting. It's intimidating just to come to a new home, a new environment, and be around new people and not know, what are the kinds of issues or comments that they're going to agree with, and what are some things they might, I might feel stupid if they don't react in the way that I hope. So it can be really difficult. And then you have ageism and you have ableism, and then there's stigma, of course, associated with dementia and cognitive impairments. You have a lot of factors at play that can make it really intimidating environment. So really important to have, create a kind of safe space where people can share and feel valued. When with both the resident and family council, as I mentioned, they have both effectively advocated and kind of been part of real changes that they could see and within the home. And I think that was really motivating and something people felt really proud of. It was moving, talking to, families and residents and staff. They were all really kind of moved and motivated by seeing the changes that both of these councils had been part of and had contributed to. It was particularly moving talking to some of the residents about what it meant to have that kind of impact, to contribute to their home. And so, making the changes to, they had an upstairs patio that they had renovated and made more accessible, and to the outside garden that they had successfully lobbied to have repaved so residents could access the space, to be able to see the change for themselves and know that other residents and families and staff could make use of it. Well, here a resident says it was invigorating. So it was really meaningful. I think the flip side is for some residents in particular, and maybe for some family council members too, when change didn't happen, or if it's really slow to happen, that can be discouraging. And make people maybe less inclined to continue on. I also just wanted to note visibility. So resident council, family council and resident council have both made really meaningful changes. Family council was on the website. I think that was something that they had, we worked hard and lobbied to have that space on the website, and they were putting in the work to maintain it. Resident council, that wasn't, they weren't on the website, and they weren't visible. Who are they and what are they doing and what have they achieved and what were some of their goals? And considering how much they had achieved, some residents had said, we should be celebrating and recognizing what we've achieved so far. But I also think it's important for the outside world to be able to see, what these councils have accomplished. And so I think it's important that both family and resident councils are visible, that, we can see what they're doing. I mean, as a researcher, selfishly, wouldn't it be wonderful to look at different care home websites, see who these councils are, see what they've accomplished, see what they're working towards. And for resident councils to be able to connect with each other, and same with family councils, to see how are the other councils doing this is also really important. So last, I just wanted to touch on just a couple of the organizational factors. So what made this work? How are they able to accomplish their goals? A key factor, and this was staff, residents, families, all really emphasized the importance of having a clearly defined process of communication with management and leadership. So on the top, I have a quote from a family member who's involved with family council. They had changed the format for how they communicated with management. So previously they had a staff liaison coming to their meetings, and that is something that staff also emphasized. That's really difficult. So if a staff member is taking in all these complaints, how do they get their peers, people who, may be more senior than they are, to respond, to follow up, to address issues, to prioritize issues that are coming out of the council? That's a big task. And these are really complex institutions that have all sorts of different hierarchies in terms of staff. So for managers and staff members, it's not always easy to get their other managers or staff members to follow up on concerns, and then they have to go back to council and they don't have that follow up and they don't have the response. So that can be really tricky. So they changed the format to having regular meetings with the senior leadership team. So they have people who can kind of represent the different departments, and also are in a position to actually make changes. And they found that really streamlined their communication and made things a lot easier. And I think on both sides, they felt that was a really effective model. For the resident council, it worked a little differently. Managers routinely came to meetings and senior leadership when they'd be invited or asked by the resident council, and they were quite present. So they would come, so they had regular communication. But it wasn't so streamlined, it wasn't so formalized, I would say. So that left some residents wondering, where's my concern going? I've shared this concern and they said they're going to follow up, but where is it going and what happens once I share it? So it just wasn't as clear. It wasn't as formalized. And so there you have a comment below from a resident, kind of what happens once we bring it up. And then last, in terms of the organizational context, just the importance of support really from the very top. That's certainly not all it takes. There was a lot of kind of grassroots activism happening here, and a lot of work from residents, families, and staff members who are engaged with these councils, managers who are engaged with these councils. But without the support from, the highest levels, it can be really challenging to affect change. And here's an example, a quote from a staff member kind of speaking to that, how it sort of changed having, the CEO really committed and prioritizing family council and helping to and giving it, helping management team to really prioritize responding to the family and resident council when they have so many competing priorities. So that was important. I think the other important point is that if we're to support resident and family councils and help them actually realize, their goals, requires a lot of resources, especially the resident council, because it requires having people there in person, having people, making sure the meetings are accessible, passing the mic, taking notes, also following up. So it can be resource intensive. And then having, you have managers from different departments and leadership who have to then respond and address issues. So it can require a significant amount of resources. So in order for that to happen, this needs to be kind of prioritized from the home. But I think and at least some staff members also made the point, we need dedicated resources too. So we have these new regulations, but they didn't come with additional resources to support resident family council. So I think that's something that really needs to be considered. And then just briefly, in terms of the broader context, well, we have these new regulations in BC, so they're much more robust, and they really promote the idea of council independence. And so I think you have, especially the family council was well informed, and it gives councils, I think, a better understanding of, or a more focused understanding of the purpose of the council. There's the guidelines that came along with this that have, good resources. But they were also connected to these kind of provincial and regional associations I mentioned, that provide information, networking, and also a platform for addressing systemic issues that kind of go beyond that individual home. And so here's a quote from another family member in the study talking about systemic issues. And, one of the issues is, you have resident family councils, they're bringing forward issues, but often those issues either can't be addressed within the home because maybe staffing is such an issue, or they're kind of bringing up these issues they're more systemic. And what happens with that? So by having these regional associations, there was at least an avenue, potential for these councils to bring forward more systemic issues, which could then potentially, go up the chain to the Ministry of Health, for example. So it provides one avenue for addressing those systemic issues. For residents, what we found was they had sort of significant barriers to accessing information, support, and really making use of these new regulations. So this was a very active council, but we quickly learned they were not aware of the new regulations, even though they felt like they were quite relevant to some of the work that they were doing. They didn't know there were new regulations. They didn't know how to access them. When the issue of rights came up, in part because I'd asked some questions during an interview, a resident brought it up then at a council meeting, and they all wanted to know more information about their rights. And we were kind of stunned, hearing a resident say, rights? Do we even have any rights? So they weren't informed about their rights. A lot of them asked about what is the purpose of the council? Like what role is a council supposed to play? Are we registered? Are we a bona fide council? They didn't know if there were other councils out there, if there was some sort of registration system, how do the other councils work? And they also wanted opportunities to connect with other councils. In fact, they brought this up at a council meeting, asking the CEO if they could connect with other councils. So this was something, they had all these questions, and so there were these new regulations, there's this new guidebook with lots of examples and ideas and tips and solutions, but they couldn't access it because they need things in person. They don't necessarily have access to the internet. Some of them are visually impaired. So they need printed resources and really in-person supports. And so I think it's important that we think about equity to make sure that residents can also access some of these resources. So just quickly, I'll try to wrap it up in terms of some implications from our research. Well, first of all, I should note, this is one care home. Okay, so we can't necessarily generalize to other contexts, other resident family councils. And we really don't know the range in terms of how resident and family councils work. What are the different models out there? Researchers, we always say we need more research. So we need more research on resident and family councils. But what we can say is that in this case, the resident family councils had unique insights, and they were able to address issues that might otherwise be overlooked. And also they were able to affect meaningful changes within the home in some quite profound ways. I also wanted to point out that residents and families are a really diverse group. So the idea that, they're supposed to come up with some consensus decisions and work on behalf of the collective, that can be really challenging, and it can be challenging to find common ground. Our findings really highlighted the importance of having support from leadership, and also a defined process for communicating, something that's clear, and also important that other councils members, so not just the chair, can see and understand how does this work. Visibility, it really matters. And I think one thing I would really love to see is more visibility of resident and family councils. So having them on their websites, having them up in homes, knowing what they've achieved and maybe what some of their priorities are, and having the potential for councils to kind of serve as a window or a connection to the outside world, because so often our care homes kind of cut people off. This is a group that, maybe another council will want to connect with them and see what they've been working on. So having a bit more of a window into what councils are doing. And then last, that regulations alone aren't enough, especially when it comes to reaching residents. So I really emphasize using a kind of equity approach here and making sure that resources are accessible and that there's supports and training for resident councils in particular. So I will just stop and there, and thank you all so much.
Thank you so much, Sheila, for providing that sort of historical background for us around resident and family councils and long-term care, and then also just really highlighting the multi-level factors that can either be a hindrance or really promote the interests of families and residents. So thank you so much for that.
No, thank you.
And we're excited to hear more about as you continue your research in Manitoba, and what differences and similarities that you can identify. So should we move? Are you ready to tackle these questions in the chat? Is that okay?
Yes, absolutely.
Awesome. Okay. And just sort of bringing everyone's attention. So Ashton just threw in the chat some helpful resources that we've sort of thrown together, that, Sheila has passed along to us, and also some resources that we've developed within the society that you may be of interest to you based on the topic for today. So let's just take a minute to scroll up, and just some comments. A comment from Scott, who they say that they started a resident council, a part of their social work practicum, and now they've been hired by Vancouver Coastal Health to start another one. So that's fantastic news, Scott. Thank you. Vita has a question regarding her third research question. How do you define and measure meaningful engagement? Is it a measure of customer satisfaction, so residents, family caregivers, or do you define it another way?
Oh, that's a great question. So I didn't use the kind of conceptual model for the project in this presentation, but where we used a model of engagement. So when you think about engagement, you can look at it sort of two ways, up and down. So are you engaging kind of at the individual level, right? Where you could think about residents having and families having a say in their care, kind of at that level. And then you can go up and think about what kind of engagement and what kind of influence they have within an organization, and then at the policy level. And then we can also think about it in terms of the level of participation. On the one hand, just at the lowest end being informed, all the way up to really being a partner and having some shared decision making. So another part of this research is looking at the kinds of engagement that we saw and where does it fall along the continuum. Do we see examples of kind of real shared partnership and shared decision making, and sort of what we saw was somewhere in between. But that's a good question around, is it about how satisfied people are? Because you could have a lower level of engagement, but that might mean people might be satisfied if they feel like they're still being heard, without having to, be, so engaged that they're, on a, committee and putting that time in. So that's a good question. So, but really we're looking at it along a continuum in terms of the level of engagement from, basically informing people, listening to people, to actually acting on their recommendations, and then actually sharing that decision-making power on the other end.
That's great. Thanks, Sheila. So it's really, is it meeting the level of engagement that the individual people want or a council wants, as opposed to something like objectively measurable? So a little nuanced. So thank you for,
I think that's a great point. Yeah.
Okay, so we have a question from Lawrence. Why do long-term care or even assisted living facilities have preset menus created by head office?
That's a great question. I don't know the answer. I mean, I imagine if you're thinking about if they're part of a corporation, so they have a head office, I think those councils might have a little bit more of a challenge in terms of affecting change, because some of those decisions aren't being made at the level of the home. They're being made even outside of that home. So I think I know my research assistant, Isabel, looked at the sort of new national standards for long-term care. So having residents have a say in menu and meal planning is considered now best practice. Whether that happens is another question, but that is, I think, something that, we should all be pushing for. Yeah.
Can I also take a stab at answer this question? Because I actually used to study mealtimes in long-term care homes. So
Thank you.
So Lawrence, answer your question. So menus have to be reviewed by registered dietitians. And so because there are folks who can eat, anything, others who are on specialized diets, so kidney, low sodium or low fat diets, those have to be screened by a dietitian and then ordered in advance. And so, and then there's a whole issue around menu cycles, how often meals repeat. So depending on the size of a home, you may have less flexibility as to how much say you have in terms of what's on your plate, because you might be ordering from a large corporation versus producing something in-house. So it depends on the size of the home, if it's a chain or if it's independently run. But because there's so much planning that goes into the food, that they're typically preset. Yeah. Okay.
Thank you, Sarah. Much better, much more thorough and accurate answer.
I was just expanding on your points. They were all great. Okay. Okay, moving on. So Heather passed along a comment from an attendee. Can someone collect admission booklets from different care homes and review and find good approaches to share and be adopted by other care homes facilitated by family councils?
That's an excellent idea. Do we have any graduate students?
I know.
In the audience, you might want to take that on as a project. I think that's a great idea. Yeah. Part of it is, you see this at the council, how much work goes into this, and then you think, what about all the other homes and all the other councils? Yeah, like we should be sharing this. Yeah, I think we should be sharing this more.
Thank you. Okay, and Lita's point is our councils post minutes for everyone to read. So that's great that you've had that mechanism set up. Thank you, Lita. So there's a question that someone sent Ashton. How many years did you say family councils have been operating in BC care homes?
Oh, well, I can't give you I can't say exactly, but what I can say is we looked at the literature, like the academic literature. We found stories about resident councils in particular going back all the way to the 1960s. So there's a really long-standing practice. Family councils come a bit later, but there was resident and family councils well before there were any laws in place to protect the rights, to give them the right to participate. So that came later, but they were certainly active before. I don't know when the first one occurred. I know the first laws to for residents to have the right to participate in BC came in 1999. But probably they had resident and family councils in place for decades before then.
Okay, thank you. Okay, we've got a question. Okay, so we have somebody from Leanne from Client Services Manager with Family Councils Ontario, and that's a great organization. I'm familiar with them. This was a great study. Great job, Sheila. And Family Councils Ontario is happy to support and share resources. So yeah, they have a lot of resources. They're a great organization, and I encourage anybody who is interested in this to check their website out. Scott, for resident councils, have you found any good strategies to provide meaningful admin support from staff who are already overburdened with tasks and reluctant to take on new responsibilities? What level of staff involvement is typical? That is such a great question.
Yeah, that's a great question. That was, I think it was a challenge and it was a source of tension a little bit at this care facility, where you had recreation staff doing that work. And then there was a question around, should it be social work? Might they be better positioned, having that advocacy kind of orientation and training? But also I think some of them felt a little bit burnt out and sometimes they felt a moral dilemma because when they did recreation activities, they might be, helping, provide recreation to 50 people at a time. And then, whereas when they helped the council they're helping a small group, and it required a considerable amount of time, and resources. So I could just say that there were tensions between staff, sometimes the council who in this particular council, they met weekly. So that required a lot of resources, a lot of time, and then leadership too. So there was negotiation happening. So it may have already changed honestly by now, but I think it is a challenge because with the new regulations, there's more expectations, but it doesn't necessarily come with any more resources. So how to navigate that, I'm not sure. Yeah,
A tough one. But Scott, just validating that that's probably an issue across the board, and an issue yet to be resolved. So I'll pass it back to my colleague Heather.
Wonderful. Well, what a really great discussion, some really great questions there, and such a great presentation as well. Thank you so much, Sheila, for taking time out of your day to share that knowledge, to share that research, and thanks to all of you who have joined on the call today. So thank you again, everyone, for sharing your afternoon with us. Enjoy the rest of your day.